This is the middle ear with its lateral wall removed. So the lateral wall of the middle ear is nothing but your eardrum or the tympanic membrane. So the tympanic membrane has been removed and you can see the inside of the middle ear. As you all know, middle ear is like a empty cube. That is, there's a cavity with 6 surfaces. Now the lateral wall of the cavity has been removed, so you can see the other 5 surfaces here, namely the medial surface or the medial wall, the superior wall, alright, the anterior wall, the floor and the posterior wall. Alright, okay. Now this figure has been enlarged from the bony picture which what you see here. Alright, now let us see the medial wall. The medial wall contains the lateral projection of the inner ear. Okay, so the medial wall is technically contains the inner ear, where the entry to the inner ear is through the oval window and round window which can be seen here, and the promontory. The promontory of the cochlea can be made out here in the medial wall. In the medial wall, you can also see the facial canal. Can you see the facial nerve traveling in the medial wall? Okay. Now this facial nerve is reaching the posterior wall and it is descending down and exiting through the stylomastid foramen to the exterior. Now, meanwhile, it is sending a branch to the stapedius muscle here, and another branch, the cauda tympanic branch. Here it is cut, and the remaining part here travels along the inner aspect of the eardrum, which is not seen here, and it goes like this. Okay, all right. Now, so that is the posterior wall has also an opening of the auditory mastoid antrum. Okay, so the mastoid antrum is behind. As you can see from this picture, the mastoid antrum is located posteriorly, and there is an opening to the mastoid antrum. It's also located at the posterior wall. Now, what is on the base? In the inferior wall, you have the internal jugular vein. That's the internal jugular vein. And when you go to the anterior wall, as you can see from here, the carotid artery is seen. Anteriorly and inferiorly, the carotid artery is seen, and anteriorly and medially, the tubotympanic tube or your auditory tube is opening into the nasopharynx. So these are a quick look at the walls of the middle ear. Okay, and one more thing, we all know when you look at the skull, the carotid artery is always seen in front and jugular vein is seen behind. So the same pattern is followed here. The carotid artery is at the front and jugular vein is behind and inferior. Thank you.